Good afternoon.
Good afternoon to you too.
I'm David Kanyile from a company called Epicenter, and we are doing a survey in the area. And your house is one of the households that had been randomly selected for our surveillance. May I come in to explain this further?
Sorry, I don't live here. I just work here. They are not here.
When are you expecting them back?
They come back around after 5 or 6 o'clock in the evening.
Okay, it's not a problem. I can come back, but I would like to leave these documents. This is the brochure that explains our surveillance, what this study is all about. We are doing an intervention in the whole area of Vulindlela and Greater Edendale. The households are randomly selected, which means no one is actually obliged to participate. And even within the household, we randomly select a single individual. So it doesn't mean then that the person that I might be engaging with will be the person participating. So it is important for our study purposes as well to get the demographics for the household. So if you could go through this, or you can give it to the family members when they come back.
So how do you do the testing?
So the test is not as difficult. It's a simple finger prick for the blood samples that we then take to the laboratory for testing. And also, depending on whether or not the person who will be selected will be male or female. If it is a male, then we ask for urine sample. If it is a female, it is a vaginal swab.
Okay, I do live here. It's just that I thought you were selling something. You may come in.
Thank you. In this short video, it demonstrates one of the objections that our field workers encounter in the field, whereby you get into the household and you find that a member of the household may deny that they are members of the household, which may make it difficult for one to conduct the survey. It is therefore important then that you provide the necessary information explaining about the study so that they make informed decisions on whether or not they continue denying participation or refusing to have their members enrolled in our survey. Good afternoon.
Good afternoon to you too.
I'm David Kanyile from a company called Epicenter. We are working in the area doing a survey. Will you mind if I may have a few minutes to talk to you?
Okay, what's it about?
It's a health-related survey, focusing more on HIV and AIDS, but we look at other ailments. It's not only limited to HIV. We conduct this to actually understand the impact that the current programs that are being implemented are being effective in the area to try and actually help improve the health systems.
So is this blood test that you're taking?
It has to do with the blood tests. We will test for HIV, we test for sexually transmitted infections. We run different tests, including HIV amongst them.
No, thank you. We have medical aid here at home, so we're fine. We
do understand anyway that when we come to the community, there will be people that will be using private services, private health services, and there will be people using public health services. But in order for us to be able to have a good improvement in health services overall, can you imagine if only the public health services if people who utilize the public health services are the only people that we engage with, it will mask the findings, because it may not then give the reflection of what will be the case with the proportion of the people within the community utilizing the private health services. So we encourage you to participate. Yes, we understand you may be comfortable, you may be well covered because you have medical aid and you have a private doctor, but for research purposes, it may really help us if your family could participate.
Okay, how long will it take?
Just about 30 minutes to an hour at most.
Okay, I don't have much time, but you can come in.
Thank you. This second scenario demonstrates some of the challenges that our field workers may encounter in the field, whereby people who utilize private services and have medical aids may not wanted to participate in our interventions. However, it is important for you as the field workers to help them understand that for research purposes, it will assist us to be able to understand what is the health context in both cases where we look at people utilizing public health services and people utilizing private health services, to get us a better picture in terms of the impact overall in the study area. Good afternoon.
Good afternoon to you too.
I'm David Kanyile from a company called Epicenter. We are working in the area conducting a study called HIPS, which is HIV Incident Provincial Surveillance System. In this survey, we go through the area visiting specific randomly selected households where we are conducting the survey, and this household is amongst those that had been randomly selected. If you do not mind, may I come in so that we can talk?
Okay, what are you going to be doing if you're coming in?
I would explain the study further to you. The two main parts of it, there is the listing component, and then there is the participation of a single randomly selected person from the household.
Oh, so is this blood test?
It has to do with blood, but we take other samples as well.
I know my status, so no, thank you, not for me.
We understand, and we knew then that for each and every household, it might happen that the person that may be randomly selected could be HIV negative, someone could be HIV positive. It is also important that even if people are HIV positive, even have gone to an extent of taking treatment, but it is important for us to have that, because that is what is going to give us the understanding of the impact of HIV in the area in two main ways. One is it is going to help us understand what is the prevalence in the area, which may happen then that the area may be under catered for in terms of health services, particularly focusing on HIV and AIDS. And also it may help us understand in terms of the incidence, which is the objective of this particular survey, to try and establish the new cases of infection. So irrespective of whether or not the person is infected with HIV, we would like everyone else randomly selected to participate in our survey.
Maybe you can come in, maybe the others will be interested, but I know my status. You can come in.
Thank you very much. In this scenario, we have just observed a situation, one of the situations that we encounter in the field, whereby certain people or households may not want to participate, mainly because their status is known, which happen to be HIV positive. The intervention that we are doing, we are actually enrolling everyone irrespective of their HIV serostatus. So it is important then for you as field workers to ensure that you help them understand that even if they could be HIV positive already, it is still important to participate in the study. Otherwise, if we were to be in the situation where we are only enrolling HIV negative people, the picture may be different, which may reflect that there are no people HIV positive in the area.